So the female reproductive system, very similar to the male reproductive system, the main function is to, sorry, where am I? The main function is to produce the ova or the eggs and to release the hormones, sex hormones. So in the case of the female reproductive system is complex in the sense that right from the start, instead of one hormone, testosterone, that's released by the testes, in the female, there are two hormones, estrogen and progesterone. Estrogen and progesterone also fluctuate. Okay, they are not a steady secretion like in the male. It is not a steady secretion. The hormones fluctuate. Okay, there are ups and downs. And because of those ups and downs, the female reproductive organs undergo a cyclical change every month. Okay. And these hormones in turn influence what is happening in the ovary and then, what happens in the uterus. So it is a little bit more complex than the male reproductive system. So the primary organ of the female reproductive system is the primary organ which is going to produce the eggs and also release the hormones estrogen and progesterone is the ovary, which is what is shown here in green. Okay, so this is the primary organ. So the primary organ, there is a pair, and they are located in the pelvic cavity, not in the abdominal cavity, pelvic cavity, behind the pelvic bone. And very tiny, almond-sized organs. Okay. And all the other structures with it are the accessory organs. So the accessory organs from the ovary, you have the two uterine tubes. The uterine tubes are also known as fallopian tube. Okay, that's another name. It's an older name, but you will still see some physicians using this fallopian tube for the name of the person. Okay, so uterine tube, fallopian tube. Another name is oviduct. So sometimes it is good to know some of these synonyms because you never know which book is going to use which term. So these are the two tubes that come from the ovary. And then you have the uterus, which is the organ into which this is going to open. The two tubes open into the uterus, which is a pear-shaped organ resting on top of the urinary bladder. So it is just behind the urinary bladder, resting on top of it, and behind the uterus is the rectum. Okay, so because you have these three structures anteriorly behind the pubic symphysis, you have the urinary bladder, then you have the uterus, and then you have the rectum. So all of it in the pelvic cavity. So that's why the urinary bladder in a female is slightly smaller in size than a male. Okay, because of this added organ that you have. Now, the lower portion of the uterus, the very end of the uterus, is called the cervix. So all these starred structures, the red starred structures, are the secondary organs. So the cervix is just the region of the uterus which is projecting into the vagina. So the vagina is this narrow tube that opens to the outside. Okay, and vagina is the purpose of the vagina. It's just a transport tube for the monthly bleeding to come out, or during sexual intercourse the sperms are deposited high up in the vagina. Okay. And then comes the external genitalia, which is also part of the secondary sex organs in the female. Now, the external genitalia, the equivalent of the penis in the male, in the female, it is clitoris. So, this is a very tiny structure found in the anterior aspect. This contains erectile tissue, but it is not as abundant as in the male, but it does have a lot of nerves and it also has erectile tissue. Okay. And then you have a fold of tissue that covers these openings. So in the female external genitalia, you're going to see the anteriorly, the first one is the urethral opening from the urinary bladder, from the urethra. The second opening is the vaginal orifice or the vaginal opening. Now, in order to protect these two orifices, you have folds of tissue and skin. So, the smaller of the folds is called labium minus or labia minora. Labia is plural. Okay, so labium minus is singular. Labia minora is plural. Okay, so there are two folds that are covering the openings on either side. And on top of that, you have another larger fold, which is basically fat tissue, adipose tissue, and skin covering it. Okay, and that is called the labia majora, or labium majus is the singular term, and labia majora. So major fold, minor fold. That's what it actually means. The Latin word means that. So all of these are part of the female reproductive secondary sexual organs. Okay, ovary being the primary. Now, another thing which, if you are going to become I might show you in a different one. Let me. This region between the vaginal opening, you see, and the anal opening, okay, this region is known as the perineum. Okay, it's called the perineum. Okay, so that skin and tissue that is between the vaginal opening and the anal opening, that is called the perineum. So during labor, okay, during childbirth, normal, if the mother is delivering through the vagina, the head, in normal delivery, the head is what comes out first, followed by the limbs and the body. So the head, is made up of the skull, and because of the fontanelles, the skull is able to squeeze through this vaginal passage. Okay, but yet the vaginal passage has to dilate, and it is the opening, the vaginal orifice is sometimes not enough to allow the head to come out. So what they do is they usually make a cut on the perineum. Okay, they make a cut on the perineum to give a little bit more space for the head to come out. And then they suture it. Okay. Now, that is called, that particular technique, or that particular cut is called an episiotomy. Some of you probably know about this. Okay. Episiotomy. So it's a neat cut. They cut from the vaginal opening, not all the way to the anal opening, but a little bit in an oblique manner, just to allow space for the head to come out. Now, why am I telling you this? Because if you're going to be a labor nurse, you are going to be performing episiotomies, you will be suturing it, all of that. Okay, so if you don't make the cut, which is what used to happen many years back when women used to deliver at home and midwives used to be there sometimes, or even in the hospital sometimes, if the episiotomy is not done, then when the head comes out, because it has to come out through the narrow passage, tearing of tissues will occur. Okay, tissues will tear haphazardly. It will not be a neat cut. So the tissues will tear. And sometimes this, because of the tear, and the tear becomes a little difficult to suture sometimes, the tear, and then that tear goes all the way up to the rectum and the anal canal. And occasionally that tear will, heal, and it will form a scar tissue and may form a passage between the vagina and the anus. It might form a passage, okay, what we call a fistula. And that's a big complication. And sometimes it can also go the other way. It can make a passage between the vagina and the urethra. So women have trouble urinating. The urine might come out through the vaginal passage, or feces. You don't see it so much nowadays because always an episiotomy is done. But that is something to keep in mind, okay? And that's why this region, which is called the perineum, is important, okay? Because there are muscles and there's skin over it. So you cut it. You cut it in order to allow uh, the easy passage of the head of the fetus. Okay, so now let's look at some of the structures. So as you can see, this is the pelvic cavity in the female. Now this is the pubic symphysis. Pubic symphysis. Now in women, you always have, in front of the pubic symphysis, you always have a collection of adipose tissue. You don't see this so much in men. Okay, so that little slight bulge that you see on top of the pubic symphysis, that is very characteristic in women. Okay, it's basically adipose tissue on top. This is called the mons pubis. Mons pubis. Mons pubis, then you have the pubic symphysis, the bone. This is the urinary bladder. And then you see the uterus. Uterus is made up of smooth muscle. And here is the vagina, vaginal passage. Okay. This is the rectum, of course, at the back. And right here, this tiny little almond-shaped structure is the ovary. Okay. And this is the fallopian tube, what you see. So structure-wise, it's not that difficult. Okay. So let's see. Again, now we have cut it up. So if you were in the lab, you would have seen all of this. We have models for this. Okay. So here again, so let's go through some of the things which are, and the legend is in the next slide. Okay. So right here is your urinary bladder. Okay. That's your urinary bladder. Q is your mons pubis. Mons pubis, the fat in front. This is the N is the urethra. Okay, the passage. Now, urethra is shorter in females. In males, it has to go through the penis, longer. So because of the shorter urethra, females have a higher risk of urinary infections, okay, or bladder infections, because any bacteria that are in the skin outside can easily go in, okay. So that is this structure that you see here, this whole thing is the uterus. Now, this lower portion that you see, lower portion of the uterus that's actually projecting into the vagina, J, that is the cervix. Cervix. And this is the region where, when they do a pap smear, you all probably have heard of it. Pap stands for Papa Nicolau. It's a stain, okay? And it is shortened as pap smear. Pap smear, the biopsy is taken from the cervix to look for cervical cancer. So usually after the age of 30, 35, you're supposed to have every 2 years, you're supposed to have a pap smear just to rule out cervical cancer so that you can detect it early. Okay, so they just take a small piece. It's an outpatient procedure. You just take a small biopsy from the cervix and then send it to the lab. They look at it under the microscope and they look for cancerous cells. Okay, so cervix is the lower portion of the uterus that projects into the vagina. Now, when the cervix projects into the vagina, you get this tiny little space on both sides, like a horn. Okay, that is the K here. The K, the label K. That is called the fornix. Fornix, fornix. Okay. Now, the fornix serves no physiological purpose. Okay. But as OBGYNs, when we do a vaginal examination, when we put a gloved finger into the vagina to feel the uterus and the cervix, the finger can go into the fornix and you can palpate the uterus. You can actually feel the uterus. This is called the anterior fornix because it's in the front. This is the posterior fornix. So the finger can be put into the fornix to feel the uterus. So early pregnancy, before we had ultrasound and all that, and before we had all these, sophisticated blood tests, we used to do a vaginal examination. Okay, you would put a finger in, you can put the finger into the fornix, and you can feel from the abdomen, you can feel the size of the uterus. Okay, still being done, okay, for many things. And then L is the vagina. Okay, now we come to the external structures. M. So this fold that you see, M, this is the labia minora, minor fold. And then this bigger one that you see outside, P, that is the labia majora. So M is labia minora, P is labia majora. And then this tiny little pinkish structure that you see that is projecting like that, O, that is the clitoris, which is the equivalent of the penis in the male, has erectile tissue. Okay, so I've just showed you the structures which I told you, the primary organ and the secondary sex organs. Now we go into the details, a little bit about the tube and the uterus, the details of that. Okay, so that's what is here. Okay, again, same picture with more detailed, and we are going to talk about some of the things here. Okay. So these are all just for practice, lots of pictures that. Now, if you were to look at the uterus and the tubes, so the ovary is a paired organ, one on either side of your pelvic cavity, very, very tiny. So think of like an almond, that's the size of your ovary. And the fallopian tube is not connected to the ovary. It's not like this. If this is the ovary, okay, if this is one of the ovaries, the fallopian tube hangs like an umbrella. The starting point of the fallopian tube hangs like an umbrella on top of the ovary. So it's not stuck to the ovary. It's just hanging like that. Okay. So these, my fingers, which are like the umbrella, these are called the fimbriae of the fallopian tube. Okay. The fimbriae. Right here. Okay. And then this palm of the hand, which looks broader, like a funnel, that is called the infundibulum. Infundibulum of the fallopian tube. Okay. And then you see this wrist of mine, which kind of turns like that. That turn is called the ampulla. So these are the parts of the fallopian tube. So the fallopian tube, the purpose of the fallopian tube is to receive the egg, the ova, and transport it. That's it. Okay. So the fallopian tube is basically made up of smooth muscle and it is lined by ciliated columnar epithelium. Okay, so there are a lot of cilia which which push the egg towards the uterus. So ovary, which is an organ in the pelvic cavity, and then the tube is just hanging on top of it, not stuck to it. I'm talking about the normal, okay? Because if somebody has repeated infections and the tube gets stuck on the ovary because of infection, that's a different thing. We are only talking about normal. So the tube, the first part of the tube is called the fimbriae. The funnel-shaped region of the tube is called the infundibulum. The turn, when it turns and goes in towards the middle to open into the uterus, that region is called the ampulla, and this is important, this region. And then the point where the tube opens into the uterus, that is called the isthmus. Isthmus is kind of a little narrow, so it's called the isthmus, where it joins the uterus. Okay, so the same thing on the other side as well. Now, what is the significance of the ampulla? The significance of the ampulla is normal fertilization occurs here. When the sperm fertilizes the egg, this is where fertilization occurs. Okay, so if you were under the impression that fertilization occurs in the uterus, no. Fertilization occurs at the ampulla of the fallopian tube or the uterine tube. So the egg, the mature egg that is released will, because it hangs like an umbrella, it'll pull the egg towards the ampulla. So this mature egg will go towards the ampulla. And the sperms that are deposited in the vagina have to travel through the uterine lumen. Then they have to travel through the tube all the way to the ampulla to fertilize the egg. Okay, that is the reason why the sperm count is so high. Every ml of semen has roughly 100 million sperms, because majority of them will die in the vagina because vagina is acidic. Many of them will die in the uterus. Only a few hardy ones are going to manage to travel through the tube right up to the ampulla. And after they reach the ampulla, one of them will manage to fertilize the egg. And once the egg is fertilized, then the fertilized egg then travels down the tube, comes and attaches itself to the uterus and starts growing as the fetus. Okay, so it takes 6 to 7 days after fertilization for the fertilized egg to come and attach itself to the uterus and start growing. Okay, so think of the fertilized egg like a little mouse. Okay, it's going to burrow itself into the uterus, and it's going to, like a mouse burrows a hole in the ground, the same way the fertilized egg also burrows itself into the uterus and starts developing as the fetus. And it takes 1 week for the fertilized egg to reach the uterus. Okay, so this is fertilization, what happens in the ampulla. And in the uterus, when the egg comes and attaches itself, you call it implantation. Okay, so that is about the fallopian tube. Now we come to the uterus itself. Okay, let's look at the uterus. Now, uterus is a pear-shaped organ which is made up of smooth muscle. Okay, now the top portion of the uterus looks like a dome. Okay, this is called the fundus, just like the stomach. Fundus, like a dome. And this is the body. So what's in the middle is the body of the uterus. The lower portion is the cervix. I've already told you that. Now, the uterus is lined by 3 tissues. The outermost, you see this light, this beige color that you see outside, that is called the perimetrium. Okay, perimetrium. Let me erase this. Perimetrium. What is perimetrium? Nothing but connective tissue. This is connective tissue. The middle layer is the smooth muscle. That is called the myometrium. So the myometrium is smooth muscle. And then the innermost layer, this is called the endometrium. The endometrium is epithelial tissue. It's epithelial tissue. Okay. So perimetrium, myometrium, endometrium. Okay. If you look at the endometrium, which is the epithelial layer, the endometrium is kind of thick. Okay. And the superficial layers, okay, there are superficial layers and there are deeper layers. So the superficial layer is called stratum. Stratum is layer. Functionalis. And the lower layers are called stratum basalis. Or functional layer, basal layer. Okay, if you want to use English, it'll be functional layer, basal layer. So it is the stratum functionalis, the epithelial cells of the stratum functionalis are the ones that come out with the monthly bleeding. So every time you have your monthly cycle, the cells from the upper layers, that is the stratum functionalis layers, they are the ones that are shed. Okay, these are the ones that are shed. The stratum basale, the stratum basalis, this has stem cells, which will divide to regrow the stratum functionalis. So every monthly cycle, you lose the layers of the top layers, the functional layer. And then the cells from the basal layer will divide and they will reform the stratum functionalis before the next cycle starts. Okay, so that's the importance of the endometrium. And it is in the endometrium that this fertilized egg will implant. Okay, so it doesn't implant in the muscle layer, it implants in the endometrial layer. It goes in and burrows itself, and during pregnancy, the endometrial layer really becomes very thick. So the fetus is able to grow there. Okay, so that is about the uterus, the fallopian tube, and then of course I told you about the lower portion, cervix, and this little gap that you see between the cervix and the vagina is the fornix, and then this is your vagina. Now in the vagina also you will see a lot of folds. Okay, you will see a lot of folds. Again, folds are called rugae. These are called vaginal rugae. Okay, so the vagina also is made up of smooth muscle, so the smooth muscle can contract, and during menstrual bleeding, it helps with the blood coming out. And during sexual intercourse, the vagina contracts and the sperms aids in the sperm motility. Okay? Now, the last structural feature here, before we go to look at how the eggs, the ova, are formed, the last structural feature is the ovaries, the fallopian tube, and the uterus are all inside the pelvic cavity. Okay. Now, how do they remain in place? You need to have connective tissue that anchors these structures in place. Okay, it has to keep them in place. Otherwise, the ovary can move around in the pelvic cavity. So you need to have ligaments that can hold the ovary and the uterus in position. Okay, there are 4 important ligaments. First and foremost, the largest of the ligaments is what is called broad ligament. The broad ligament stretches from the ovary and the uterus all the way to the bones, the pelvic bones. Okay, so that it anchors it in place. So as you can see, the whole thing here, this side it's not shown. So all of this is the broad ligament. Okay, then comes another ligament which is rounded in shape. It anchors the uterus to the side walls. This is called the round ligament on both sides. Okay, it will be on both sides. Here it is only showing one. So broad ligament, as the name indicates, is extremely broad. Round ligament is the one that connects to the uterus to the wall of the pelvis. Yes, Jason.
Are the broad ligament, is that where a lot of uterine cysts are developed?
Uterine cysts, actually, you can have cysts developing in the broad ligament, but when you say ovarian cyst or uterine cyst, it is usually within the ovary, the surface of the ovary, or in the uterus. We usually call them fibroids, rather than cyst per se. You can have inflammation and cyst formation in some of these ligaments, but ovarian cysts are usually more common, which is seen on the outer surface of the ovary. Okay. And uterine cysts can be anywhere. They can be on the surface layer of the uterus or in the deeper layers. It can be anywhere. Okay.
Thank you.
Yeah, you're welcome. So that's the round ligament. Then two more ligaments, ovarian ligament. So this whole thing that you see, sorry, here, let me change this a bit. So this is coming from below, okay? It's going to come from the uterus. That is the broad ligament that you see here. Sorry, round ligament, this one. Okay, it's going to come from the uterus through the broad ligament and attach to the wall of the pelvis. Then you have a shorter ligament that is going to come from the lower pole of the ovary and attach to the uterus, what you see here. This is called the ovarian ligament. And then, so this is from the lower pole of the ovary to the uterus. And then you have another one from the top pole of from the top of the ovary to the wall of the pelvis. This is called the suspensory ligament. So the suspensory ligament is usually surrounded by the ovarian blood vessels. Okay, so 4 ligaments. So let me show you here. So you can see, you can see the broad ligament as well. So you see that's the broad ligament here. This is the ovarian ligament. Okay. The only thing that is not showing here is the round ligament is not very clearly seen, but the round ligament will attach the uterus to the wall of the pelvis. So that, and this one at the top is the suspensory ligament. Okay. So 4 ligaments that help to anchor the ovary and the test and the uterus to the wall of the pelvis, the tubes and everything. Okay. So that is what it is. So this is again just we have the same model, a huge model. So you can see the pretty much similar things. So the one that connects the ovary to the uterus is the ovarian ligament. The ovary to the wall of the pelvis, 15, is a suspensory ligament. And then you can see the different parts of the fallopian tube. So this ampulla is the important place where the fertilization occurs. And then you can see this is where the fertilized egg has implanted itself. So it takes about a week for the fertilized egg to travel through the tube and come and implant itself here. Okay, and then it begins to grow. Okay, so that is about the structure of the ovary itself. Now we come to the development. Okay, so this is a cross section of the ovary. Okay, a lot of time, this is the exact same model. You see a picture of it in your manual as well. Very often when students see the see the model in the lab, they always think it is probably the breast tissue, the mammary gland. No, it's not. This is the ovary. Okay. So this is showing the development of the egg. Okay. And this is where the complexity arises. So now it's about 1:25 now. I want to go into this, but before this, in case any of you are going to step off at 2, um, because of any other, if you have any other classes, I I would like to give the before we go into this, and this is the important part. You know, it's an open book exam. You can look at your books and answer, but this is something which I would like all of you to understand. You know, women, of course, uh, you need to know this because part of your body. Men also need to know this because you're going to be working in healthcare, and also, you have to know what's happening in the body. And this is a little complex part of the female reproductive cycle. Okay, so let me give you the announcements. So after class today, by today evening, lab exam 3 and lecture exam, final exam, will be uploaded. You will have until May 11th, which is next Monday, until May 11th to complete both those exams. Lab exam 3 is on digestive system and reproductive system, male and female. 60 points. Okay, the same thing. Lecture exam is also on digestive system and reproductive system. Only thing, immunity is also included for the lecture exam. Okay, so lecture exam is digestive, reproductive, immunity, lymphatic system, and immunity. Okay, I've posted the audio files for that. Lab exam is only on digestive and reproductive, which is male and female. Okay, now May 11th, 11:59 p.m. is the deadline. Beyond that, if you send me an email saying, can I get an extension? You will not get an extension because that's a hard deadline. Okay, so far, some of you have had, issues. You've asked me to extend. I've done that, but not this time. This is the final. So you have to make sure that you find time. I'm giving you almost a week, Monday to next Monday. So make sure you have time, find the time to finish the 2. And like I said, they are not timed. So you can do them. You can finish a few. It saves the answers and then you can come back to it. Do not hit the submit button before you finish. Okay? So beyond May 11th, absolutely no extension can be provided because May 12th, I have to put the grades in. So I cannot give you an extension. Second thing, do not forget to do the mastering homework assignment on digestive system and reproductive system, which is also, I have given you a deadline till May 11th. A lot of time. It was available to you earlier. I know some have done it. So please do that May 11th. Okay? Again, no extensions. I've posted the lab attendance extra credit points is already up. Lab report grades for almost half the class is up. Some of you are not seeing the lab manual report grades because I'm missing something. So I'm going to call out the names. Okay? Whoever is here, I'm going to call it out and I'm going to tell you what are the labs that are missing. I need you to email me the completed lab. You can scan them or take a picture. Email it to me by tonight. Okay? I'm not giving any further time because there have been students who have submitted on time and their grades are up. So whoever has not submitted, you are late. So I'm giving you until 12 midnight today. If I see your email has come after 12 midnight, that will not be counted. It will not be counted. Okay. So please pay attention if your name is going to come up. There are some who have not submitted anything. Okay. So you know that that is for 60 points, your lab manual reports. And I've really not deducted too many points for anybody. I know some of you had mistakes, but I have not deducted. But this is what it is. Okay. So let me start with urinary was the last one. So Carla and Sean, I do not have your urinary lab manual report. Okay. Next, respiratory and urinary. So respiratory system, there were 2 reports, urinary, 1 report. Respiratory and urinary, Mariam, Omar, Marlene, Blanca. Mariam, Omar, Marlene, Blanca. Respiratory and urinary. Only urinary, Carla and Sean. Now, third, cardiovascular, respiratory, urinary. 3. Okay. You can imagine when we finish cardiovascular system, I still haven't received the report. KT. Cardiovascular, respiratory, urinary, KT. Okay. Blood and urinary. Hannah and Esmeralda. Blood and urinary. Hannah and Esmeralda. Ayub. Blood, cardiovascular, respiratory, urinary. Ayub, blood, cardiovascular, respiratory, urinary. Angel, I haven't received any from Angel. Endocrine, blood, cardiovascular, respiratory, urinary. Okay. So you can imagine this is actually not my job to be behind you to tell you to submit. Okay. I had to sit down, look through my organizer, and write down the names of people who have not submitted, which one was not submitted. This is really not my job. Okay. When I tell you something has to be submitted, it is for you to make sure that you submit. So you are getting only till tonight. Okay. No more. No more. So I'm going to repeat this again. Urinary, Carla and Sean. Respiratory and urinary, Mariam, Omar, Marlene, Blanca. CVS, cardiovascular system, respiratory system, urinary system, Katie. Blood and urinary, Esmeralda and Hannah. Ayub, blood, cardiovascular system, respiratory system, urinary system. And Angel, endocrine, blood, cardiovascular system, respiratory system, urinary system. Okay. So there was no other way that I could communicate. I could not send a separate email to all of you, each one of you saying that this is not, you have not submitted. And then many a times you don't even read the email. You send an email to me, but you don't see whether I've replied or not. So sometimes you don't see the email. So that is why, pardon me, I had to do it in class. Okay, so that if you want the points, then I don't want you to miss it just because you were unaware that you did not submit this. Okay, so whoever is interested, you can submit it to me. Okay, yes, Katie.
So for the lab reports, we're only doing up to the digestive system.
Urinary.
Okay, so no okay.
So yes, only urinary, because digestive, you had, my colleague took the lab, so I'm basing those 60 points off endocrine, blood, cardiovascular system, respiratory system. There were 2 reports for respiratory system anatomy, respiratory system physiology, and then urinary. Okay, so 6 in total, basically.
And
So
you want us to complete the entire lab report or did you have them marked down like how sometimes you only
I
have
have
first?
already mentioned all that in the lab, okay, which I
Okay.
will not be able to mention again. So you'll have to, I had mentioned which of the questions needed to be done, okay? So you can find out from your friend and get that done. Okay, so please send it to me by tonight. Okay, anything later than 12 midnight will not be accepted. Okay, so any questions on this? Other than that, if all your points are uploaded, as and when you finish your mastering homework assignments, that will go in. As and when you finish your lab exam, it will go in. It'll all get graded on its own. And these are all going to come from a question bank. So no two students will have the same question. So try to do it because it's an open book. Try to do it on your own. Okay. So it's not like a group activity. Try to do it on your own. So any other questions you have? I wanted to give this announcement so that, in case any of you are leaving. So I think from my side, I have told you. Yes, Jason.
I do apologize. I know that you have repeated it. When will you open up the tests?
This evening.
Okay, thank
It'll
you.
be uploaded this evening. Okay. Soon after our class is done, maybe an hour after that, I'm going to upload it. Okay. So you will see both the lab exam as well as the lecture exam. Both will be available to you. And you have the whole.
Can I
Okay.
ask you something?
Of course. Yes, please.
The mastering AP online, like I haven't finished it, the whole on a reproductive system, and it was graded, but now I finished it. So you're gonna upgrade that grade, right?
It'll automatically upgrade it.
Oh,
Just give it 24, I mean, a few hours because it doesn't transfer quickly from mastering to Canvas. So check it again tomorrow. It'll be fine.
okay. Thank you.
It'll always take your best grade. Okay.
Thank you.
So, and the only thing is, if you finish the homework and then immediately look at your Canvas grade, it'll not reflect it correctly. Give it a few hours or maybe the next day, check it. It'll be fine. And if it is not, you just send me an email. Okay. And I'll do the needful for that.
Got it. Thank you.
You're welcome. Okay. Any other questions?
So, Professor, we don't have to come on May 11th, correct?
No, no, no,
Okay,
no.
thank you.
So as you finish, your grades will automatically go into your Canvas, and then on the 12th I will have to put the letter grades in. That I have to put.
Okay, thank you. And also the what do you call it? The review guides that you used to post. I don't think I saw that posted for lymphatic and immunity.
Lymphatic, and because those are open book, that's why I did not post
Oh,
it.
okay.
Okay.
Okay, thank you.
Yeah. Okay, let's look at this last part, which is development. How does the egg develop, and how does it correlate with the female menstrual cycle? Okay, so I think I need to put, okay. So the female monthly cycle, or what is also known as the female menstrual cycle, is monthly changes that take place in the ovary and in the uterus. Okay. So the menstrual cycle on an average is roughly about 28 to 30 days. 28 to 30 days. Okay. What happens in the ovary is called the ovarian cycle. What happens in the uterus in that 28-day period is called the uterine cycle. Uterine cycle. The two together are called the menstrual cycle or the female reproductive cycle. So we'll start with ovarian cycle because this is the prime thing. What happens in the ovary will then determine what is going to happen in the uterus. So On an average, women have a 28 to 30-day cycle. Some women have shorter cycles, some women have longer cycles. I'll talk to you about that, but in general, 28 days. Okay. This 28 days is divided into two halves. So the 14th day, there is an event that occurs, and this is called ovulation. So ovulation splits this 28-day cycle into two halves. The first half from day 1 to day 13, day 13 is called the follicular phase. Follicular phase. Day 14 is ovulation. Day 15 to day 28, okay? No, day 15 to day 26, okay, is called luteal phase. Luteal phase. So the ovarian cycle is split into three parts. Follicular phase, which is from day 1 to day 13. 14th day is ovulation. Day 15 to day 26, day 28 is luteal phase. Okay. How do you count the dates? How do you know which is day 1 of a new monthly cycle? Day 1 is the first day of bleeding that you experience. When a woman experiences the first day she has bleeding, that is the first day of a new cycle, new ovarian cycle. Okay. A lot of times, if you talk to women, they always count their cycle from the day the bleeding stops. That is not correct. The day the bleeding begins is a new cycle in the ovary. Okay. So day 1 is that. And from that day, you count 14 days. That will be ovulation. From that day, you count 28 days. That will be the end of that cycle. Okay. So we are going to look at this ovarian phase, this ovarian cycle. So day 1 is the first day of bleeding. So let's see what happens. So in the ovary, now I want to remind you, the ovary, remember the stem cells, the oogonia. When we talked about meiosis in the last class, oogonia are formed before birth. Okay, no new stem cells are formed after birth. So oogonia are the stem cells which are going to give rise to the eggs or the ova. The oogonia are formed before birth. Okay, and then I also told you, during childhood, there is programmed cell death of the oogonia. So even before the girl child reaches puberty, the ovary is losing oogonia. So when the girl child attains puberty, roughly there are about 300 to 400,000 of these stem cells in the ovary. Okay, and where are these stem cells located? These stem cells are located on the outer aspect of the ovary, not on the inside. So this is called the cortex. Okay, so the thick covering that you see, the uterus, this thick connective tissue covering, is the tunica albuginea, just like the testis. And underneath that, the outer portion of the ovary is called the ovarian cortex. The inside where you see these blood vessels, that is called the ovarian medulla. Okay. So it is in the cortex that you're going to see all the developing cells. Okay. So these stem cells are located in the outer region, very close to the capsule of the ovary. Okay. Now these stem cells, which are found in the ovary, these are called primordial follicle. I'm sorry, this picture is a little small, but this is from your textbook. Okay, it's called the primordial follicle. Now, what is the primordial follicle? In the middle of the follicle, you have the main cell. Okay, the stem cell, which is called the primary oocyte. Primary oocyte. And it is surrounded by a single layer of cuboidal cells called follicular cells. Okay, a primordial follicle is made up of a single cell, okay, with a nucleus and surrounded by a single layer of epithelial cells, which are cuboidal. Now, these cells are called follicular cells. The main stem cell is called the primary oocyte. Now, this primary oocyte is diploid. It has 23 pairs of chromosomes. 23 pairs. Okay, and this is going to undergo meiosis. Now, during that first 1 to 13 days, okay, when day 1, not one primordial follicle, about 15 to 20 primordial follicles will start developing. They'll start enlarging. Not one of them, 15 to 20. Okay. So every cycle, roughly about 15 to 20 of these stem cells will start developing. Okay. The next stage, by about day 5 or so, you are going to have a slightly larger cell, slightly bigger in size, called a primary follicle. Now, what is the difference between the primordial and the primary? The number of layers of follicular cells. Okay, these cells, I told you there's a single layer, but many layers will develop around the oocyte. Around the primary oocyte, many layers of follicular cells will develop. Now, these follicular cells are also known as granulosa cells. That is another name, okay? Granulosa cells. If you remember follicular cells, you're fine. There's no harm in that. So instead of a single layer of follicular cells, there will be multiple layers of follicular cells. So it's going to become bigger. And instead of just one layer, there'll be multiple layers of follicular cells. And this primary follicle, these follicular cells that you have, the cells that you have, will start secreting estrogen. So the first hormone will start getting secreted. So the follicular cells start secreting estrogen. Okay. So try and stay with me because this is not very easy to understand. So this happens by day 5. Okay. By day 5, not all 15 to 20 will become primary follicles. Many will die. Only, let's say, about 5 to 10 of them will become primary follicles. Out of the 15 to 20, only half of them will become primary follicles. So this is another mechanism by which women lose stem cells. Every cycle you lose. It's not just one cell that is going to form the egg. Many of them will perish. Okay. So that's why by the time the woman reaches the age of 50 or 55, the ovary has no more stem cells. Okay. So primary follicle is by, let's say, approximately day 5. Then day 5 to day 8 or 9, the next few days, this primary follicle becomes even bigger. And you now call it a secondary follicle. Now, the secondary follicle, the only difference is that size is bigger. The number of follicular cells, the layers increase. And in the middle of the follicular cells, you are going to see small pockets, empty pockets filled with fluid. So spaces will begin developing. Small spaces will begin developing within the follicular cells filled with fluid. Okay. And this secondary follicle will continue to release more estrogen. So from day 1 to, let's say, day 10, if you take a blood sample from a woman, you will see the estrogen level increasing. Because this follicle that is developing is going to secrete estrogen. And estrogen is a hormone, so it is going to be released into the bloodstream. So you'll be able to detect estrogen during the first half of the cycle. Okay, but the second hormone, progesterone, very low levels during the first half of the cycle. Now, this secondary follicle, so during this period, meiosis has already started. So remember meiotic division. First meiotic division, the pairs will separate. Second meiotic division, the copies will separate, the sister chromatids will separate. So the first meiotic division already begins. Okay, it has started. So this cell that you see in the middle of the secondary follicle, you call this a secondary oocyte. It's called a secondary, not a primary oocyte. It's called a secondary oocyte. Okay, and you're going to see small cavities filled with fluid. By day 13, so this secondary follicle, so about 5 to 10 of them will become primary follicles. Secondary follicle, even less. Maybe about 3 to 4 of them will become secondary follicles. Rest of them will perish because they can't survive. Okay, only 3 to 4 of them will become secondary follicles. And out of these 3 to 4, by day 13, okay, let me erase all this so that you know. So 3 to 4 will become secondary follicles and they'll continue to secrete estrogen. Out of this 3 to 4, one of them will become what is called a vesicular follicle. A vesicular follicle, or another name for this is mature follicle. Mature follicle, or another name which honors the person who described it, Graafian follicle. Graafian follicle. So what is this mature follicle? This mature follicle is nothing but the secondary follicle, those cavities that were filled with fluid, all cavities will join together to form a big cavity filled with liquid. And this secondary oocyte will be pushed to one corner because of that cavity that is filled with fluid. So this mature follicle forms around day 13. Okay, so let's look at this model that you have. So the first one, these tiny little yellow ones, are the primordial follicles. Okay, then they become a little bigger, surrounded by a single layer of cells. This is a few layers of cells. This is the primary follicle. Next stage is secondary follicle. All of these, primary, secondary, will start secreting estrogen. Okay. Then this is the mature follicle. So this is that big cavity filled with fluid. This tiny yellow structure is the secondary oocyte, which has been pushed to a corner, and the follicular cells surrounding it. Okay, so you can see how all of this is happening in the outer aspect of the ovary, and it actually, when it reaches this mature follicular stage, it will actually cause a small bump on the surface of the ovary, a swelling on the surface of the ovary. Okay, so let me show you another picture of a vesicular follicle. So you see, this is the mature follicle. So here you have the primary follicle, primordial follicle, primary follicle. This is the secondary follicle beginning. This is the mature follicle, these two here. So you see how everything, this is the antrum, is the space filled with fluid. This is the secondary oocyte, which has completed the first meiotic division. Okay, second meiotic division has started. Secondary oocyte, and then all those follicular cells are pushed to the corner because of the liquid that is inside. Okay, so this is under the microscope, this is how it look. Okay, so you see these are all the follicular cells or granulosa cells, another name for them. This is the antrum, this is the space filled with fluid. This is the secondary oocyte. And then the secondary oocyte has a very thick plasma membrane, cell membrane, which is very clearly seen under the microscope. And that cell membrane is called zona pellucida. Okay, so the sperm has to pierce through this zona pellucida in order to fertilize the egg. So the cell membrane of the secondary oocyte is really thick. And then there is like a crown, the follicular cells surrounding the secondary oocyte. These are called corona radiata. Corona radiata. So this is the structure of a mature follicle that is formed on day 13. Okay, on day 13 this is formed. And the pressure of the liquid, because the liquid is here, the pressure of the liquid is so high that on day 14 this is going to burst. And this secondary oocyte along with that corona radiata is released into the cavity. And then because the fallopian tube is so close, the secondary oocyte enters the fallopian tube. Okay, so sometimes the secondary oocyte, instead of entering the fallopian tube, can accidentally enter the pelvic cavity. Okay, it can enter the pelvic cavity also. Rarely that happens. So that is when sometimes a secondary oocyte that has entered the pelvic cavity occasionally, very rarely, can get fertilized by a sperm. And that is what is called abdominal pregnancy, which can never go through to term. Okay, it's very risky, but that can happen. But in a normal person, because you see all the changes are happening on the surface of the ovary. So the mature follicle is going to form a swelling on the surface of the ovary. And then when it bursts, the liquid that is inside will push the secondary oocyte to enter into the fallopian tube. Okay, so this secondary oocyte is the one that gets released during ovulation. So what happens during ovulation? The secondary oocyte is released. Okay, now the story doesn't stop here. Okay, so up until this vesicular follicle that you're seeing here, I should have used this one. So starts with primordial follicle, 15 to 20 of them. Okay, they become primary follicles, and then about half of them will become secondary. Half of them will become primary follicles. 15 to 20 primordial follicles, 5 to 10 primary follicles, and then about 3 to 4 will become secondary follicles. 1 will become the vesicular follicle. So during this period, estrogen is the predominant hormone that is being released. Okay, estrogen. Then comes ovulation, middle of the cycle, ovulation. The follicle ruptures. See what is released. The secondary oocyte along with the cells surrounding it, the corona radiata. You can visualize this if you do an ultrasound. Okay, especially nowadays, women they freeze their eggs. Okay, so this is how it is done. So an ultrasound is taken, and right at the time of ovulation, you can actually see on the monitor the follicle bursting and the oocyte being released. And then you can harvest the oocyte. So for in vitro fertilization, all of those assisted reproduction, you can harvest the oocyte like that. Okay, because you can visualize it. It doesn't stop here. After day 14, the oocyte is released into the fallopian tube. But this empty follicle that is there in the ovary, this follicle is still there. This empty follicle gets converted into a mass of cells called the corpus luteum. So from day 15 onwards, you will see the corpus luteum. The corpus luteum begins to secrete progesterone and estrogen. So this is when the second hormone will come into the picture. Estrogen is only secreted during the first half of the cycle. Progesterone gets secreted during the second half, along with estrogen. What is the structure that releases it? The cells of the corpus luteum. So this will continue from day, where's my picture? This will continue from day 15 to, let's say, day 26. Progesterone will be released into the blood. Estrogen will also be released into the blood. And then by day 26, if that egg that was released during ovulation, if this secondary oocyte does not get fertilized, if it doesn't get fertilized, then this corpus luteum starts to degenerate. It starts to become smaller and smaller and smaller. And as it degenerates, the secretion of progesterone and estrogen starts to fall. Okay. This degenerated corpus luteum becomes a scar tissue. It remains in the uterus. You can actually see the scars of the corpus luteum, prior corpus luteum. So it becomes a scar tissue, and it is called corpus albicans. So this is the development of the female reproductive cycle. Okay, so this picture. So this is the mature follicle. This is the follicle that has just ruptured, empty follicle. This is the corpus luteum. So all this yellow one that you see, that is the corpus luteum. Because remember, estrogen and progesterone are steroid hormones. They are synthesized from cholesterol. So the cells have a lot of fat. Okay, so they'll always be yellow in color. So this is the corpus luteum which secretes estrogen and progesterone. And then when it becomes the scar tissue, this is what it is. It look white in color. So corpus albicans. So this model shows you the development of the ova and what happens in the ovaries. Okay, so all of the stages are shown here. Now the corpus albicans will develop only if pregnancy does not occur, if the oocyte does not get fertilized. If it gets fertilized, then of course that's a different situation. The corpus luteum will continue to survive, and then the placenta will be formed, and the placenta will take over the function of producing estrogen and progesterone throughout pregnancy. Okay, but in the normal menstrual cycle, this is what happens. Okay, so now I'm going to show you, if you don't mind, another few, maybe 15 minutes or so, we will finish off this cycle. Okay, and the rest of it, actions of estrogen, progesterone, you can read up. That's not a problem. So I don't want to keep you. Okay, as I told you, I'm not a big fan of Zoom classes. So, because I really don't know how many of you are listening and how many are not. So that's my basic problem. So let me share. Now this is the important one. This picture is the important one. Okay, so let's see what happens. I talked to you about the ovarian cycle. And if you have any questions, please ask. So, pointer. So you see, this is the ovarian cycle that I was talking to you about. Day 1 to day 14. This is called the follicular phase. Day 1 to day 13. Day 14 is ovulation. Day 14 to about day 26 is the luteal phase. And then the corpus luteum degenerates to form the corpus albicans. Now, what are the hormones that control it? And then we are going to see what happens in the uterus. So, follicular phase. Follicular phase. Why is it called follicular phase? Because it is the follicle stimulating hormone that stimulates the development of the follicles. So these are anterior pituitary hormones. Okay. So again, let me remind you, we've talked about this in the endocrine system. Hypothalamus releases gonadotropin releasing hormone. Gonadotropin releasing hormone in turn acts on the anterior pituitary to release two hormones, FSH and LH. Follicle stimulating hormone and luteinizing hormone. So follicle stimulating hormone. That is the reason why the hormone is named like that, because it stimulates the development of the follicles during the first half of the female cycle. So FSH is the most important hormone which causes development of the follicles to the primary follicle, secondary follicle, mature follicle. And as these follicles develop, what is the hormone that is being released? Estrogen. So you see how the red line is increasing slowly during the first 13 days? This is because the follicle produces more and more estrogen as it becomes bigger. Okay. You don't see progesterone during the first half of the cycle. Progesterone levels are very low, the green one. They are very low. Now, by day 13, estrogen levels peak. The estrogen that is secreted by the follicle peaks. This high level of estrogen in the blood has a positive feedback effect on the anterior pituitary gland. So this is one example of positive feedback other than oxytocin release. This is the only other example of positive feedback for hormone control. The increasing level of estrogen that is being secreted by the mature follicle signals the anterior pituitary that the follicle is ready for ovulation. So this is a positive trigger for the anterior pituitary. And what the anterior pituitary gland does is it causes a sudden increase in the secretion of LH, luteinizing hormone. Okay, so this LH surge, what we call as the LH surge, this mid-cycle LH surge is absolutely essential for ovulation. Without the LH surge, ovulation will not occur. Okay, it's important to know this because all your birth control pills will not allow any of this to happen. They'll not allow the LH to increase. So if you can stop the LH surge, you can stop ovulation. It will not happen. Okay, so this mid-cycle sudden increase in LH is necessary for ovulation, and it is also necessary for converting the empty follicle to the corpus luteum. So the LH, so the first half of the cycle, follicle stimulating hormone is important. Second half of the cycle, luteinizing hormone is important. So LH is necessary for ovulation. And once ovulation occurs, the corpus luteum now begins to secrete both estrogen and progesterone. So that's why the progesterone, you can see it increases in the second half. Okay. And by day 26, if this egg has not fertilized, this corpus luteum will degenerate. It will become corpus albicans. Once it degenerates, the level of estrogen and progesterone will start falling because the corpus luteum is not alive to secrete the hormone. Okay. So then we come to the uterine changes. But before that, the next question is, how long can the secondary oocyte survive after it is released? After ovulation, how long can it survive? Okay. This secondary oocyte that is ovulated can only survive for 24, roughly 12 to 24 hours. That means just one day. If it is released on the 14th day, it can survive until the 15th day. 15th day, it will die. Okay, so the lifespan of the secondary oocyte is only 12 to 24 hours. Okay, let's look at the lifespan of the sperm that is deposited in the vagina after sexual intercourse. The sperms are deposited in the vagina. How long can they survive? They can survive for 48 to 72 hours. That means 2 to 3 days. 48 to 72 hours. So the secondary oocyte after ovulation can survive for 1 day. Sperms can survive for 2 to 3 days in the female reproductive passage. So now you can understand what is the best period for a woman to get pregnant. The first 10-12 days, no use. Nothing is going to happen because there's no released egg. The last 10 to 12 days, nothing can happen because already the oocyte is dead. So the best period for a woman to become, to conceive or to have a, baby is from day 12 to day 16 of a normal cycle. Day 12 to day 16. This is called the fertile period of a woman's cycle. And you will be surprised, many of your patients may not know this. The fertile period is between day 12 and day 16. Why? Because sperms can survive longer. And you also don't know when ovulation is actually going to happen. So, day 12 to day 16, sexual intercourse during this period has a higher chance of pregnancy. Anything before that, anything after that is not going to be fruitful. Okay, because this is where the lifespan becomes important. So the egg can only survive for 12 to 24 hours. Sperms, once deposited, can survive for 48 to 72 hours. So this is called the fertile period, day 12 to day 16. So that's why if this egg doesn't get fertilized, that's it. The corpus luteum will start degenerating by day 24, day 25, and it will become the corpus albicans. Okay. Similarly, if a person does not want to get pregnant, they can avoid sexual intercourse during the middle of the cycle. Not a foolproof method, but some religious communities follow that. If they don't want to take medications, they follow what is called the rhythm method of birth control. Rhythm method. That means sexual intercourse, avoiding sexual intercourse during the fertile period of a woman's cycle. Okay. Now, women have differing cycles. Some women have shorter cycles, some have longer cycles. Which phase of this is going to change? It is always the follicular phase that is shorter or longer. The luteal phase is always 14 days. Luteal phase is always 14 days. So if you want to know when ovulation occurred, you count back 14 days from the day of your first bleeding. Okay, you count back. That will be the day you ovulated. The follicular phase can be longer. Instead of 14 days, it can be 20 days. Or it can be shorter. It can be 12 days, 10 days. But the luteal phase is never change. It's always 14 days. And how much of blood do you actually lose? Even if you are bleeding for 3 to 5 days, roughly 70 milliliters. And we have 5 to 6 liters. Roughly, we lose about 70 ml of blood during each cycle. Now let's look at the uterine cycle, because the bleeding, where is it coming from? It's coming from the uterus. Okay. It is the endometrium. I told you the superficial layers of the endometrium are the ones that are getting shed. So, day 1 to day 5, is called menstruation. Okay, this is called menstruation. Because that's when bleeding is happening. So we call it menstruation. It's right here. So you can see this. This is it. So the superficial layers are coming out. And along with that, what is coming out along with that epithelial cells? This dead oocyte. Okay, so every cycle, if this is not getting fertilized, during that bleeding, this dead oocyte is coming out. Okay, because it's going to come. And then let's say from day 5, bleeding stops. From day 5 to day 14, under the influence of estrogen that is being released by the follicles, the superficial layers of the endometrium will grow back. Okay, they'll start growing from the stem cells which are in the bottom. So the thickness of the endometrium will start increasing. Okay, it will increase, let's say, by a few centimeters. This is called the proliferative phase. Right here at the bottom that you can see, proliferative phase. So just like the ovarian cycle is divided into 3 parts, follicular phase, ovulation, luteal phase, uterine cycle is also divided into the first 5 days is called menstruation or bleeding. Then day 5 to day 14 is called proliferative phase when the endometrium thickens. And then day 14 to day 28 is called secretory phase. Secretory phase, where the endometrium becomes even thicker and it prepares itself for implantation. In case the egg gets fertilized, the endometrium is preparing itself for the fertilized egg to come and attach itself, implant. Okay, so the endometrium becomes thicker, the cells begin to store a lot of glycogen so that they can provide nutrients to the fertilized egg. So it becomes even more thicker. So this is called the secretory phase. Okay, but of course, if this egg does not get fertilized, it's going to die. So, estrogen and progesterone in the second half, both of them thicken the endometrium even further. But once there is no more estrogen and progesterone after the corpus luteum dies, this endometrium cannot survive without estrogen and progesterone. So the endometrium starts to degenerate, and that is what starts your bleeding, and that's the start of the next cycle in the ovary. So the bleeding from the endometrium is happening because estrogen and progesterone levels have dropped. So the endometrium cannot sustain itself. Okay, so bleeding begins. So remember, it is the first day of bleeding that indicates the start of a new cycle. Okay, not the end of the bleeding. Okay, that's how you start. So any questions on this? Anything that you need to know? This slide is a comprehensive slide showing you very nicely. Your book has it as well. But the only mistake that I see here is this part. FSH should be higher. Okay? Oh, sorry. FSH must be higher, not LH. So this blue line should be above, because FSH is the main hormone that controls the development of the follicles. Okay? So any questions you have? Anything on this? Anything other than whatever, anything related to the reproductive system. But having said that, some of the effects that you see after menopause, okay, now that's a good question, because I want you to see how the hormone levels are fluctuating. So in females, you see the anterior pituitary hormones are also fluctuating. Okay, there's a surge in the middle. And then the second half, LH is more. First half, FSH is more. And then estrogen and progesterone are also fluctuating. So you see estrogen levels are high during the first half. Second half, progesterone is high. So you don't see a steady level like that. You don't see a steady level. Okay. That is the importance of the female reproductive cycle itself. And this is the basis on which birth control pills work. Okay. So if you take birth control, if you look into birth control pills, the traditional pill used to be a small combination of estrogen and progesterone. The woman has to take estrogen and progesterone every day. Small amount. Okay. Nowadays you have a lot of advancements in that. You have like you know a vaginal ring that can release estrogen and progesterone. You have patches that can be put under the skin, which will, instead of taking pills every day, there are patches that can be put under the skin which will release estrogen and progesterone. And a woman may not have her cycles for 3 months or 6 months. So there are different types of patches that are available. Or there are intrauterine devices that can be put into the uterus to prevent pregnancy, and they also release estrogen and progesterone. So the basic idea of a birth control pill is that the woman takes a combined estrogen and progesterone pill every day, and by taking this pill, what is she ensuring? She is making sure that the level of estrogen and progesterone in the circulation is maintained constant. Okay, it is maintained constant. So, one second, guys, I just have to. It's a constant level, there is no fluctuation. So, when the body detects the estrogen and progesterone levels are constant, the feedback that goes to the anterior pituitary is there is enough estrogen and progesterone. So stop, reduce the secretion of LH, reduce the secretion of FSH. So what is ultimately going to happen when FSH secretion goes down, when LH secretion goes down, follicle development stops. Ovulation cannot occur because there is no LH surge. If ovulation does not occur, corpus luteum cannot form. So this is the basis for a birth control pill. Okay. So the woman, when she takes the birth control pill, no follicles develop, no ovulation occurs, no corpus luteum is formed. Okay. That's the basis for birth control pills. Now, think about menopause. So in menopause, what is going to happen is there are no more stem cells in the ovary. There are no more stem cells. So obviously, none of this development can occur. So the ovary is completely, if you take an ovary of a menopausal woman, you will not find any active cells. You will only find scars of the corpus luteum. You will find corpus albicans. That's it. No new stem cells will be there. So when there are no stem cells, there is no development. Okay. And because of that, there is no estrogen and progesterone being released into the circulation. So no estrogen and progesterone means every tissue in the body which was being affected by estrogen and progesterone now has to learn to live without estrogen and progesterone. Skin, brain, bones, heart, blood vessels, all of them. Okay, because estrogen is heart protective to the heart, it is protective to your blood vessels, it ensures that, bone resorption doesn't occur. Now, with no estrogen, no progesterone, every cell has to adjust. So, in a menopausal woman, what are you going to see? Because there is no estrogen and progesterone, there is no feedback to the anterior pituitary. So, the anterior pituitary thinks, oh, there is no estrogen and progesterone. So, I need to increase FSH and I need to increase LH secretion. So in a menopausal woman, if you do a blood sample, you will find increased FSH and LH secretion, which is the normal. Okay. But the problem is this increased LH, which is seen in menopausal women, can have its own detrimental effects. So they think that the hot flashes that a woman experiences during menopause is basically because of this LH. It's because of the LH. And a woman is at a higher risk for osteoporosis and heart attacks. The skin becomes dry, the skin becomes wrinkly, vagina dries up, reproductive organs dry up. Okay, cycles will stop. Many of them complain of a lot of muscle pain and things like that, fatigue after menopause. And in some women, it also affects the mental state. In a handful of women, it can become so problematic that bordering on psychosis, it'll almost look like a mental event, mental disorder. The problem is just because there is no estrogen and progesterone. Some women sail through it. Okay, they have a few towards late 40s and 50s. The cycles will become irregular. They may experience a little bit of hot flashes and headaches and all that, but then they may smoothly enter menopause. But then they have to make sure that their bones are strong, and they have to make sure that's when, after 40 and 50, that's when their diet and everything, exercise, because they are at a higher risk for heart attacks, so they have to be careful. But some women have severe mental issues, severe hot flashes, and in these people, hormone replacement therapy becomes important. You are giving them supplements of estrogen and progesterone to help them tide over that period. You don't have to give it for life. Give it so that they are able to, handle their symptoms and then smoothly go into menopause. Okay, so if you talk to your parents, mothers, you might be able to, in those days, it was not very common, but when you talk to them, they may share some of their, symptoms that they had. And some of them really had to go through severe changes, okay, mood changes. And all of this, because of this, this cyclical, this fluctuating way in which hormones are released, that also accounts for a lot of your mood changes that you see during your menstrual cycle. Okay. At the time of ovulation, day 14, you might find bloating. Estrogen causes water and salt retention. So you'll have bloating, pain. Some women actually experience abdominal pain at the time of ovulation. Okay. And your mood swings are also because of some of these fluctuations that you have. Okay. So any other questions? Anything else? Okay. Effects of estrogen, progesterone, effect of testosterone, all of that you can, those are simple enough to read. Let me know if you have any questions. Anything else? I see some of you have already sent me. Okay. Yes, any other questions? If not, good luck to all of you in your future endeavors. Do keep in touch if you need any help. I'm always there. At least for the next two and a half years, I'm going to be there. So drop by the office, email me so that I know how things are going with you. So, anytime you need any help, reach out.